Hello guys, my name is Bilal Beydoun and I'll be giving a presentation regarding the measles virus. Just some background information about measles. It is a viral infection that is most commonly known to infect children. However, this does not mean that it does not also affect adults. Measles is a respiratory infection and it can spread through the rest of the body. It is very important to be noted that the measles virus is highly contagious, so if someone is infected with the measles virus, it is important to get them away from other students, other faculty, prevent any spread or outbreak of the disease. Symptoms of this virus include cold-like symptoms such as high temperature fever, red or swollen eyes, white spots in the mouth, as well as red rashes. The red rashes are typically the giveaway for this disease. They usually occur about 4 to 5 days after exposure. They start at the face and neck and slowly work their way down to the hands and feet. There are 3 phases of the measles disease. The first phase is the prodromal phase. This phase marks the beginning of symptoms and it's usually about 1 to 3 days after infection. The next phase is the exanthématis phase, which is typically 3 to 5 days after infection, and this is the start of the rash. At 3 to 5 days, the rash will start at the head or neck and start working its way down to the feet and hand area, as I just stated. The last phase is the convalescence phase, which is typically the healing period, I would say, and this phase is very different depending on who it is. It could last 2 weeks, it could be 3 weeks. Everyone's different, but this is the final stage of the measles virus. Now, treatments of the virus is very tricky due to the fact that it is a virus. So because it is viral, it has to be noted that antibiotics will not work with this disease. Antibiotics are typically used with bacterial infections. Measles, it won't work too much. So when we're talking about treatment, symptoms will typically start to subside a couple weeks after infection with no medication or anything like that. However, if a student is experiencing severe symptoms and is uncomfortable, over-the-counter medication such as ibuprofen should be able to help with that. Now, routes of transmission are very important to talk about because this is how we'll be able to prevent a spread or outbreak from occurring. Routes of transmission include direct contact, airborne transmission, as well as contaminated surfaces. Knowing this, the best way to start preventing this disease would be to practice good hygiene, which includes covering your mouth when you're sneezing or coughing, as well as washing your hands frequently. This means after lunch, after using the bathroom, in between classes, etc. Another way to prevent this disease would be to encourage social distancing among students. The farther away they are from each other, the less probability they are to catch this virus from direct contact transmission. Obviously, the most crucial and helpful disease prevention measure would be herd immunity, which is achieving a high vaccination coverage among students. Doing this would prevent vaccinated students from catching the disease and unvaccinated students from passing the disease on to another student that's vaccinated. So it would severely decrease the spread. On the left here, there's a chart that displays the number of measles cases throughout the past over a decade. It is obvious here when we look at this chart that it is very random. There's no trends, there's no way of predicting when a measles outbreak will occur. So the best time to act when trying to stop this virus is now. One reason for an outbreak obviously would be a low vaccination rate in a community. This would cause one person catching the virus to be able to contaminate hundreds of others. So obviously the most important way to prevent this disease from spreading would be vaccination. On the chart displayed on the right, it is all the states with a 95% or higher vaccination rate. Statistically speaking, these states would have a very, very, very low probability of having an outbreak occur within the community. Thus the high vaccination rate. Taking initiative. Several steps should be taken to ensure no outbreaks of this virus occurs at this school. The first step would be sending out measles information packets to all parents to encourage their children to be vaccinated, not only to protect themselves, but to protect other students. The next step would be placing hand sanitizer in every classroom, ensuring students are always clean and their hands aren't carrying any bacteria. The third step would be for all students to wipe down their desks because, as stated before, contaminated surfaces is a source of transmission for this disease. So wiping down desks is crucial. Lastly, we want to encourage students who are sick to stay home. However, if they are already at school or if they must stay at school, highly encourage mask wearing to prevent any airborne transmission. In conclusion, the best way to prevent this disease would be herd immunization. Obviously, vaccination is going to be the best way to prevent an outbreak from occurring. Practice good hygiene, symptom awareness, make sure all students know the symptoms. So if they do have the virus, they know. The treatments, knowing that rest is all we can do, and making sure a student stays quarantined away from anyone else to prevent the spread. And also note that outbreaks are random. So there's no waiting for an outbreak to happen before we can start protecting our students. The best time to act is now. No one knows when an outbreak can happen.